Now that we've learned how to crush our med school interviews, how about residency and fellowship interviews? What are the differences and what tips and tricks can you use to succeed at those? So some of the main differences, one of the main ones is that for residency and fellowship interviews, the pool of people being interviewed is much smaller. Like for med school, you might have 400, 500 people being interviewed. For residency, you might have like 50. And then for fellowship, you might only have like 10 or 12 or 20 based on what kind of fellowship you're doing. So it's smaller and it's more personable. So this means that for residency and fellowship, you most likely would have done some sort of a rotation at that school or that program and work with some of the faculties. And for a fellowship interview, I actually had a faculty interviewing me that I actually worked with clinically, and he wrote me a reference letter. Typically, that is going to be a conflict of interest if they wrote your reference letters, and they'll swap you out. But this fellowship program particularly was very small, and they only had just a handful of clinicians, so then they were not able to outdo that. Either way, it's going to be much more personal, and a lot of these residency and fellowship interviews won't have any MMIs, and usually there's be no knowledge testing, medical knowledge testing. However, there are some specialties that do test your medical knowledge, particularly like cardiology. Residency at Toronto is infamous for this. They'll give you like an ECG and they'll be like, interpret this. And you got to interpret it on the spot and you have no idea what it is. Some other times might give you an x-ray and an ECG and they're like, okay, what do you think is happening with the patient? How are you going to manage it? What dose of medication are you going to give? And so that's intense, but that is not standard and that's not normal for a lot of residency. For internal medicine and subspecialty, for ICU, for example, when I did the interviews, there was no medical questions. There were some ethical scenarios around the medical situation, but there wasn't any medical overt knowledge that you need to memorize or know. So again, it'll be more personable, it'll be more casual as well. In residency, because you've done the rotation in that school, they'll expect that you know some of the ins and outs and some of the culture there, and that's something you actually want to talk about in the interview to the best of your ability. And again, I think one main thing here to emphasize for residency and fellowship is the level of intimate knowledge that you have about the culture and that program, the better your chances of doing well in the interview. So if you're there and doing rotations, I would highly advise that you meet with the program director, the residency program director and the fellowship program director. Introduce yourself, see what they need, see what you want to do, what your interests are, and create that rapport, create that relationship early on, just during the rotation. And I think that will go a long way because the program director is always part of the interviews and they'll remember you. They'll remember you meeting them for coffee. So everywhere I went for ICU rotations or internal medicine rotations, I would always email the PD like a month or 2 months in advance and I'd say, hey, I'm coming here for this long. I'd love to meet you for coffee and love to learn more about your department. And I'll just ask them questions that I want to know. I'd want to know stuff like, what kind of things do you value in your candidates? What kind of culture are you looking to create? What's your 5 to 10 year plan for your residency program? Where do you see yourself going? What are some of the weaknesses of your residency fellowship program? And some of these questions I would ask straight up to the program director. And I'd also ask the residents I would work with. I think, a lot of people are afraid of asking these questions because they think it'd look bad on you. Personally, the way I look at it is it helps me make a decision of where I want to go. Because some cultures in residency and fellowship programs are toxic AF. I don't want to go there for good reason. So I actually want to find out for my own benefit. And so 1, I would recommend you do that and obviously do it in a respectful way. And then 2, it also gives you more information so you can make a more educated opinion, right? For example, if a PD says, yeah, our goal is to focus more on medical education over the next 5 to 10 years and really double down on that, but your interest maybe is in AI and which another program is focusing on, then you can kind of consider, you're like, okay, this doesn't really align with my long-term goals or what I want to become. So then it just helps you make that decision. So I would ask that meet them and really get to know what the program is about and where they're headed and whether you can see yourself fitting in or not. So I would say shift the focus on trying to impress them to figuring out for yourself whether this is the right program for you or not. And as you shift that focus onto yourself, I think you're going to be making better decisions, and you will be able to do that too because most of the time, residency and fellowships aren't as competitive. Caveat being some are, like cardiology, gastroenterology, critical care, for example, in Canada, are usually the top 3 most competitive specialties. Regardless, though, you should still make the best decision for yourself. And so I would kind of come from an approach of, okay, would I want to come here? Would I want to do this? Is this going to help me get to where I want to be? If you want to be an academic intensivist in Toronto, going to like Dalhousie ICU in Halifax is not really going to help you get to that goal, right? So just think about it from that perspective. And one of the main things, I think, qualities that they look for in these residency fellowship interviews, they're very casual. They'll probably also ask you the same questions about tell us about yourself, strengths, weaknesses, why this school, etc. So we already covered that. But one of the, I think, main thing they look for really is, can we work with this person? Because in residency and fellowship, you're going to be working with the faculty who are interviewing you as colleagues for a long period of time, several years at some residencies. So what they really want to see is, can I work with this person? That's the question they're asking themselves. So if you're able to answer that, if you're able to get along, in this situation, residency and fellowship interviews, I would say be more open, be more free, show more of your personality, make jokes. I was definitely making jokes during my fellowship interviews. Like the ICU interviews were so casual and so lighthearted. It was just a casual thing. And I was just making jokes. I was just like being myself. And it was awesome. It was actually a fun time, I would say. The med school interviews were not fun. They were stressful. But the fellowship, the ICU, and the internal medicine residency interviews, I would say were more fun because I was genuinely just getting to know whether I want to be in this program or not, and I like these people or not. And they were thinking about the same thing. So I think it gets less difficult as you go on to your med journey for the interviews. And if you're doing like subspecialties and sub fellowships, they're much easier because they're interviewing like 5 people. And so they know you and you know them. And then the last thing I would say is for the residency interviews as well as the fellowship interviews, go to the social events. This is where you'll see what the culture is like, what the people are like. I went to a social event for internal medicine interviews at McGill, and only 2 residents came out. They were the chief residents, and then I think another couple of residents came later, but they looked so disheveled. They looked like they were miserable. They all had like black eyes or eye bags under their eyes, and they just looked so exhausted. They looked like they hated their lives. And when I asked them, they were like, yeah, we work a lot. We don't really get as much teaching. And the residents will genuinely tell you like the experience. And you won't find that in the interviews because the interview is going to be like the chief resident or like the PD, and they're all obviously going to like say good things about the program. So I would say go to the social events, go to these residents, ask them how they're like, are they happy? Are they getting time to like enjoy their life? Are they finding that they're able to advance their career, have enough opportunities? Like ask these questions because at this point you're making like very key career decisions and you want to make sure it's the right one for you. And one last thing I'll leave you with for residency and fellowship interviews is that if you have a specific subspecialty or career in mind, for example, if you want to become an interventional cardiologist, go to a residency program that has an interventional cardiology program. So not all programs will have subspecialty fellowships available. So the ones that they do, it's easier because you get enmeshed in that area. You get to meet the different interventional cardiologists. They get to see how you are, how you work, and how you get along with the department. And so it's easier when you are applying for the subspecialty or the fellowship at the same institution, your chances of getting are much higher. So that's probably one of the biggest tips I'll leave you with on that front.